The American Cancer Society has released new guidelines for breast cancer screenings. WDSU medical editor Dr. Corey Hebert tells us how he feels about them in this morning's Weekend House Call.
Here we go again. In the middle of Breast Cancer Awareness Month, the American Cancer Society has new breast cancer screening guidelines. Just what we needed to confuse us a little bit more. The new guidelines delay the recommended age when most women should start receiving annual mammograms from 40 to 45. And that's not sitting well with doctors at some of the nation's top cancer centers. For instance, Sloan Kettering is not going to change their recommendations, which call for annual mammography starting at age 40 for average risk women. Other doctors feel that the new guidelines aren't really that different from the prior American Cancer Society recommendation, which said that women should have annual mammograms starting at age 40 and continue as long as they're in good health. The new guidelines do offer mammography as an option for women under 45. But the American College of Radiology and the Society of Breast Imaging are also standing firm against the new guidelines. They released a joint statement Tuesday saying they will continue to recommend that women get yearly mammograms starting at age 40. Specifically, under the new guidelines, the American Cancer Society recommends that women aged 45 to 54 receive annual mammography screening and at age 55 switch to screening every other year. Women 40 to 44 should discuss mammography with their doctor and exercise the option of starting annual screening based on their risk factors or personal preferences. The guidelines were changed to reflect new data that indicate that the average risk of breast cancer increases as a woman nears menopause, according to the American Cancer Society. They found that women who are 45 to 49 are very similar to women 50 to 54 with respect to the burden of cancer, the risk of dying from cancer, and the reduction in mortality from mammography. So what does your favorite doctor think? Well, I feel that screening annually among younger women saves the most lives and is the right thing to do. The new guidelines place too much emphasis on the potential harm from false positive readings among women receiving regular mammograms. Sure, it's a scary few days and it's not fun, but many women are actually reassured that extra effort has been taken to make sure that nothing is going on. One thing that I am sticking to is self-breast exams. You know yourself better than anyone, so do those exams regularly. And if you ever feel something that's wrong with anything on your body, don't wait for anybody's guidelines. You go in and you get checked. I'm medical editor Dr. Corey Hebert with your Weekend House Call.